The video you're about to see may be sensitive for you, so full disclaimer, but this is cupping therapy. I'm going to show it to you what it looks like, why does it look the way that it does, and what it actually does. How can benefit somebody who has chronic pain. Hi, I'm Danny, owner of Curvin Massage and Healing Arts, and I help women like you live with less pain and more joy. Now, let's get to it. So what you're seeing here is not a bruise. It does not hurt. It actually feels like a deep tissue massage. But this is blushing of the skin because circulation and oxygen is being pushed into the tissue, into the muscle. And as you can see, there's a lot of stagnation happening here, meaning her muscles are lacking oxygenation. When this happens, it's why we hurt. When our muscles are tense, they are not getting enough blood flow and circulation into the area. So they tense up, the fascia dries up, it gets stiff, it gets hard, and creates more pain. Now, these are my favorites because I like to call them pepperoni pizzas because they look like pepperonis. But this is also signs of a stagnation. She presents piriformis syndrome, has issues with pain in the buttocks. Um, she has a little bit of scoliosis, which elevates one of her hips, and it's creating a lot of discomfort and pain for her. The more purple they get means that there's not enough circulation going into the area. So these usually last for about 5 to 7 days. For some people, it's a little bit more than that. That's not the usual, but it can happen. What I recommend for people who are doing cupping therapy is that you increase your hydration, your water intake. Hydration aids your recovery. Another thing that I like to recommend when I have clients doing cupping therapy is soaking on Epsom salts or using a magnesium cream. Some people like to use arnica, and even though it's not a bruise, discoloration has happened on the skin, and you can definitely use arnica to treat the area. Ice is great as well. And just keep in mind, that it's absolutely normal to have post soreness after doing cupping therapy. And one of the things that I like to highlight is that as a therapist, I love to train my clients, explain what this is, what is it going to do. And also, I like to start really slow because there are therapists out there who are too abrasive with cupping therapy. They do not warm the tissue before applying cups. They are not taking the steps to make sure that your skin is desensitized, and they're not communicating with their clients, and their clients are in pain and not having a great experience because the therapist does not know exactly how to perform cupping therapy in the right way. So be mindful of that. It should never, never hurt. A little bit of discomfort, of course. If you have pain, if you got stuff that is chronic, you're going to feel it, but it should never make you hold your breath and feel like you're going to pass out. All right. That's all I got.